Hi everyone.
Hello. We are just waiting for people to join in so we can start.
Faz calmamente, encher-me, não?
In the meantime, can I try sharing my screen and see if it works?
Sure, Dr. Aslam.
Yes. Let's see. Um, just a second. Yeah, yes. Can you see my screen?
Yes.
Okay.
I think we can make a start. Huh.
Okay. Yes, I was waiting for a green light. Thank you. Yes, hi everyone. It's
Hi,
very nice.
Azan. How are you?
Good. Oh, Afshan, it's nice to hear from you.
It's nice seeing you as well. How are you doing?
Yes, doing fine. Thank you. Yes.
Okay, great, great.
Yes. So I see that we have well, new faces, people I don't know, but also colleagues that we have been working together for a long time. So it's very nice.
Azan,
So we
do you want introduction?
um let me see how many are. Oh, we have 47 people. Um, I
That would
think
take more than half an hour then.
yes, then we would spend 1.5 hours perhaps for an introduction, but we will have interactive exercises, and so it will there will be time for introduction. Yes. Okay. Yes. So it's very nice to have you, and I'm looking forward to talking about photo voice. It's one of my favorite topics. So in this refresher training, so we will talk about the process of photo voice. For some of you, you are already familiar with it. I also see that we have participants from our Burns project. So they are in the field implementing photo voice at the moment. And we also have future facilitators for the ABC Moving On project. So we will talk about key challenges, some challenges that we have been facing in the field while implementing photo voice, but also some of the challenges which are inevitable. And we will also discuss those, some ethical considerations, and we will have we will have a role play. And we will also do lots of reflections. And so it will not be only me talking, but we will also hear from you. Afshan mentioned about introductions. Perhaps I should introduce myself first before we
I
start
think that would
diving.
be lovely. The people who are attending our workshop first time, they would be knowing. Yeah.
Yes, yes. So I'm Özlem. So I'm based in University of Manchester as a postdoctoral research fellow in Center for Primary Care. I work with many of you in the Burns project. I'm together with Dr. Ali. I don't know if he's here now. So we are leading a work package on health communication campaign for burn survivors. And we are incorporating, as part of this work package, we are incorporating photo voice in the health communication campaign. And my background is in clinical psychology, mainly digital interventions, implementation of interventions, evaluating them, also photo voice and participatory action research methods. Yes, so today it's my pleasure to be with you all. And I am part of Global Mental Health Cultural Psychiatry Group. So I have been working with PIL for many years for now. Yes. Okay, so let's start talking about photo voice. And we have 2 hours for this, for our session. But I think, so this is a refresher training. So I'm aiming to keep it 1.5 hours, but let's see how we get on. Yes. Well, for me, this is actually one of the key messages. It tells everything about photo voice. And one of the key reasons why, instead of doing plain interviews or collecting data through questionnaires, we use pictures to gain deeper understanding of people's experiences about a particular phenomenon. So we do this in the Burns project as part of the health communication campaign. To have a deeper understanding of people's experiences. Of course, many of you are experienced in running interviews, and you could do this with interviews as well. But pictures, pictures tell a lot of things, perhaps things which are not easy to communicate through words. And that's the main key idea behind Photo Voice. If you don't remember anything from this refresher training, please keep this away with you. Take this away with you. A picture worth 1,000 words. New participants, welcome. I see that Dr. Rubina is also here.
I'm sorry.
No problem. We have just started. Yes. You haven't missed anything. Yes. Okay. So let's go back to the basics and first talk about photo voice process. So photo voice, it's a way of engaging people, and it's a way for researchers to deepen their understanding of a particular issue, as we mentioned. It's a process by which people can identify, represent, and enhance not only their experiences but also their community or their understanding of an issue through a specific photographic technique. So what Photo Voice does is that it actually gives cameras to the hands of people, and it enables them to act as recorders of their own experiences. It also uses the immediacy of the visual image to promote an effective participatory means of sharing experience and knowledge. So Photo Voice is usually, it's often used, it is a participatory action research technique, and it is often used for problems which are specific to specific communities. So we use it in the Burns project, for instance, with Burns survivors. And so it doesn't only give them opportunity to talk about their own personal experiences, but it also gives them opportunity to reflect on the context of living with burn injuries in Pakistan, for instance. So what are the social challenges? What are the day-to-day challenges that they experience living with burn injuries in the context of Pakistan, for instance? So it gives them opportunity to reflect on their personal experiences, but also in the context. So we also gain a lot of, through their pictures, we also gain a lot of insights about the context where the problem is happening. So in this context, Photo Voice has, we can summarize the goals of Photo Voice into three. So self-empowerment is one of them, is one of the key objectives of Photo Voice. So it enables people to, so like I said, not only their personal experiences of an issue, but also the context. But it also helps us to gain deeper understanding of their strengths. So for instance, in the Burns project, so burn survivors who are participating in the Photo Voice process, so they take pictures of their experiences of living with burn injuries, but through discussions of their experiences, their pictures, we also gain understanding of how they are coping. So what are their strengths living with burn injuries? Yes. So photo voice process, so we will talk about it. So photo voice reflection workshops, they bring people together, people who have similar experiences of an issue. So it also facilitates connection, so people don't feel alone. So it also gives them opportunity to connect with others who go through similar experiences. So in this way, photo voice also has a therapeutic value. And because it's a participatory action research method, so photo voice also advocates for change. We will also see when we are discussing the photo reflection questions, that one of the questions of photo voice is it asks participants, how can we use your picture to improve the lives of others? How can we use your picture to advocate for the things you have been experiencing in your community, for instance? So in this way, photo voice also bridges the gap between research and real life, and it advocates for change. Any insights, questions until now? If you raise your hand, I will be able to see. Or Miss Kanwal, yes.
Yes. Assalamu
Hi.
alaikum. Assalamu alaikum. It's a pleasure to have Dr. Osman. And my question is that this photo voice technique is quite new to us. So actually, what you are referring to, I'm unable to grasp that. If we can have an example initially, for me, ab tak aapne, so far what you have explained seems to me like an HFD sort of thing, the human figure drawing or the house tree person sort of test. Is it something likewise or is it something quite different than that? So actually, I'm not getting what we are learning. So can we have an example?
Yes. We will, thank you, Kanwal. We will talk about examples, but we have actually photo voice facilitators from our Burns projects with us. And I saw Atika was in the room. I don't know, Atika, if you would like to give an example from your experiences as a facilitator. How is the photo voice process for you?
Assalamualaikum.
Hi, Atika.
Hi. As a facilitator, first, there must be, as you have to see the cultural diversity where you are going to do that photo work. But in a context of Pakistan, mostly in Quetta, that rapport building, that you have to make people understand that ये person से ये करना है for this, and यहाँ पे आप ही decision maker. इनको समझाने वक्त वो आपको ज्यादा मतलब टाइम लगते हैं, आपकी एनर्जी ज्यादा वेस्ट होते हैं इस बनस्पत में।
Excuse me,
यहाँ
I'm
उनको
interrupting.
समझा
Excuse me, Atika, I'm interrupting. Oslam, is it okay if Atika explain Kamal in Urdu? Is it okay
yes,
for
yes,
you?
yes. It's
Okay,
absolutely fine.
thank you.
Yeah,
Thank you,
we can have,
Oslam.
yes, thank you, Afshan. We can have discussions in Urdu. That's absolutely
Okay,
fine.
Atika, continue, please. Thank you. Thank you, Oslam.
Sure, ma'am. Like rapport building would be the main problem, and you have to make people understand about the process, and that trust built होना एक लंबा process होता है इसमें. Cultural diversity, trust, confidentiality को make sure करना, because this is something new in a context of Pakistan, and for the people of Quetta, that's something really new and challenging, that you how and which technique you are gonna use to engage them in a whole process. That's a big challenging for us.
Thank you, Atika. Taiba, hi.
Hi, Aslam. Just for Kamal, because we will, I think, understand the process, Aslam, as we go along, how the projected tests that Kamal has mentioned are different from the photo voice approach. the main similarity is, Kamal, in both approaches, we are using photos as a stimulus to help people share their experiences. So this is the main commonality between the approaches. The process is different because this is not based on the projection school of thought. The rationale of using PhotoWise is different from the projective techniques. Stimulus is the same, and again, the process is different. So we will learn about the process as we will go through the stages. And maybe, Kamal, I think it would be a good exercise if towards end of the workshop, if you would help us to explain the difference between these two approaches.
Inshallah, I'll try my best. Can I ask a question now? Sure. Acha.
Yes, please.
So my question is, please explain me what the photo is. A photo in this technique is a standardized photo that we are going to use, or is it that photo which we are going to take it from the client or ask them to draw it? What is the photo actually?
I think Oslam
Yes.
will explain this. We have the slides, Oslam. So
Yes, yes,
we will
do.
get the
We will-
clarity. Yeah. Thank you.
Yes, we will take step by step and go through the process and talk about the photo. Yes, but it's very nice that Taiba pointed out the difference between projective technique, using photos as a projective technique, but also using photos as part of photo voice, which are quite different, but we will take step by step. Yes. So it's nice to hear the questions, but hopefully by the end of this session, so the questions will be answered. But I saw that Atika raised her hand. Atika, I don't know if you wanted to add to this discussion.
No, it was just related to that picture that she asked that picture should be random or standardized. Then Ms. Taiba said you will explain further. That's why I have put it down my hands.
Oh, okay. Okay. Good. Thank you. Yes. So we said photo voice is a participatory action research method. So in this sense, so the roles of the participants and your role as a facilitator are different. So participant might have all these roles during the photo voice process. So participant is a listener. So participant listens when it's a group setting and other people, they bring their pictures about a particular issue. In the context of ABC Moving On, they will be pictures about, for instance, their day-to-day experiences living with the breast cancer diagnosis, for instance. So participants, they will bring their pictures to the process. And so when they are presenting their pictures, discussing their pictures, so the others will be listeners, for instance. And participants, they will also be co-thinkers in the process. So that means they will be involved in asking questions about each other's pictures. They will reflect on each other's sharing or give feedback, express their opinion about each other's pictures. And so participants, for instance, they can be advisors. Let's say if participants bring an issue in the group setting about struggling with taking a picture or finding words to express their experiences. So participants, they could give input from their own perspectives, because the voice brings people who go through similar experiences. So in this sense, they could also be partners. So they could work together, for instance, to find captions for their pictures. And so they could also be decision makers. So how the discussions will be used, for instance, to give messages about the experiences of breast cancer survivors. So they will be the decision makers about how you use these discussions, how you analyze the results of of your meetings with participants. So they will be the decision makers in that sense. So they are very much involved. So perhaps this is one of the key differences between using pictures as a projective technique or using pictures as part of this photo voice process. So it is very much interactive. It requires participants' involvement. And you as a facilitator, you facilitate the process. You ask, so we will also go through photo reflection questions. You ask prompting questions to help participants express their views about their pictures. So the power dynamics is more or less equal between facilitator and the participant. I think this is also one of the key differences between using pictures as a projective technique but photo voice process. Because using pictures as a projective technique, you are the experts. So you are the expert in terms of what people are communicating. But when it comes to photo voice, when people uses pictures in the photo voice process, so they are the expert. So as a facilitator, you do not intervene with the way they express, they communicate their experiences. Yeah. And if it's a group setting, the photo voice process, so the participants, they can, so facilitator facilitates discussion, but participants can also take lead in the discussions. Yes. And in terms of the role of the facilitator, yes, the facilitator remains neutral about participants' experiences. And this means that, for instance, in the context of breast cancer, so participants, through their pictures, they would share sensitive things. And it's very important that the facilitator, while facilitating the process, also remains empathic and sensitive in terms of the things participants share about their pictures. So, and facilitator initiates a discussion with the other participants about the context of the pictures, about experiences of other participants. Yes, but we will go through this during the role play exercise as well. Yes, Kanwal.
So my question is, there is a term which is saying the facilitator remains neutral and sensitive. Okay, neutral
Yes.
means what I am getting is being non-directive and non-interruptive initially maybe, but what does it mean by sensitive?
Well, yes, that's a very good question. My experience, my understanding of being sensitive is trying to leave room as much as possible to the participant to share their experiences. Sensitive is, it also means reflective practice. Those who are, for instance, there are people here seeing clients, working in the field as a therapist, for instance. Perhaps it's similar to that context. So we as facilitators, when people share their pictures with us, for instance, during the photo voice process, of course, we also have feelings. Perhaps facilitators from the Burn Project can also reflect on this. So we also have feelings. We also have understanding of their pictures. But it's not our job to tell participants, oh, this is what you want to communicate. This is what you want to say based on this picture. But we ask questions. We help participant to find their own words to express what they mean by the pictures. So this is more or less the role of the facilitator. Any facilitator from the Burns Project who want to yes, reflect on this and tell us about what sensitive means for them. I know Atika is here. I don't see everyone, but yeah, it could be anyone. But we do have lots of discussions, actually, the role of the facilitator during our supervision sessions. I don't know, Taiba, if you want to reflect on this.
Sure, Oslam. So I think my understanding with this term of facilitators being sensitive to the experiences of the participants. Somebody in the chat also said being empathetic. So yes, this does mean being empathetic and understanding of the experiences of the here we are using the example from life of breast cancer survivors. So they should be able to understand the the emotional challenges the breast cancer survivor going through. So this is mainly that. And by the term sensitive also mean that you should be sensitive enough not to miss any experiences that are possible in the life of a breast cancer survivor, because whatever the type of interview is, whether we are using photo voice as a tool or whether we are using other ways, just the face-to-face standard interviews, we always use prompts, we always use probing questions. So being sensitive means if participant is not coming up with experiences and they are not in flow of the conversation, we should be sensitive enough to pick this up and give them prompts, give them options to to facilitate the direction of the interview to make it more productive. I think Rabil also wants to add.
Yes.
Also.
Rabbi?
Yes, I wanted to say that at times participants bring the general photographs to us, which are not directly related to that experience, because that experience might be so much reminding them of the experience they have gone through and they are not comfortable discussing it within the group. So by sensitive, we mean that we do not have to be so much intrusive. We don't have to be saying that tell us more about it, even if the participant is denying it, is not comfortable sharing about his experience in front of the group. So we have to be sensitive that how much information he needs to share within the group, and we have to give him the space how he's explaining about his experience. So this is being sensitive towards the participant, which I believe.
Yes, Rabbi, thank you very much for emphasizing the ethics, which we will touch upon later on. But yes, because it's we try not to be intrusive and give them space so they decide what they want to share, how much they want to share. That's one of the things. Yes, Afshan?
I just want to say that from the beginning, what being neutral and sensitive to the experiences means that from the beginning we have to build confidence with the participant. So that from the beginning, once you have the confidence with the participant and you are not trying to do the trauma they have gone through to rub that and start the questions at once when the participant is not comfortable. So we need to give, as you said, space and time and not to hurry with it, that what we want, and we need to give them time so that they are comfortable enough to understand that, yes, they are ready now to share those sensitive points with us, and they have that confidence in us that their confidentiality will be kept and they will be trusting us with that. So I think with the sensitivity, it means that.
Yes, thank you, Afshan. Yes. sensitivity to participants' feelings, sensitivity towards ethical principles that we need to follow. Yes, sensitivity towards how other people, because we are talking about images. So images can be interpreted in many different ways, and they will be interpreted in a group setting. So when other participants share their, let's say, views on pictures of that participant who shared a picture. So during the discussions, people will share their own interpretations, their own perceptions. And sometimes this can be challenging. Sometimes it might not be positive, how they view a picture of someone else. So sensitivity towards all those things. Someone wanted to share? Atika, was that you? I think you raised your hand.
Yeah, at that time I raised, then it was related to the sensitivity, as the process is about they recall all the process the patient have been through that traumatic event, so we have to be sensitive from all the angles.
Yes, yes. Okay. Yes. So up until now, we did talk about photo voice as a concept. The key principles, some key principles, that it's grounded in participatory action research. We did talk about the role of the facilitator, photo voice facilitator, and the participant. Now we will go through the process. And we did have a discussion on, the role of the facilitators. Yes, especially being sensitive.
Tahira,
Right.
beta, you need to mute yourself. Thank you.
Okay, yes, let's go through the process. So the process starts with introductory workshops. So the main objective of introductory workshop is to introduce photo voice to the group of participants so they can learn about the process, about the ethical considerations, and provide their informed consent. So this is your first scheduled meeting with your participants. And if it's a group meeting, because it's an introductory workshop, it can be a group meeting or it can be a one-to-one meeting. If it's a group meeting, it also allows participants to get to know each other. So those who are interested in the project and they want to know more about Photo Voice. And one of the main concerns for the introductory workshop, because that's the very first meeting with your participants, is actually what Afshan pointed out. It's about creating a safe space. Because Photo Voice is about people taking pictures of their own experiences, pictures of things which are hard to communicate through words. And in the Burns project, so these are pictures of burn survivors about their day-to-day experiences living with burn injuries. Pictures showing their struggles, their resilience, pictures which showing their personal private experiences, perhaps. Or in the context of breast cancer survivors, these would be pictures of their day-to-day experiences, or perhaps the stigma they experience being a breast cancer survivor, or pictures of their experiences of their own diagnosis. So people will take pictures of all those things. And those experiences are usually, they are hard to communicate through words. And so in this first introductory workshop, it's very important to create a safe space to give people confidence that, oh, this is a space and it's okay to express myself through the pictures that I take. It's okay to express myself in my own in my own terms. So it's very important to spend time on building this safe space with the participants. Yes. Yeah, one key aspect is of building trust is developing a genuine relationship with the participants. So we have done quite a few introductory workshops in our Burns project. And I wonder if anyone wants to share experiences from introductory workshops, building trust with participants. And I know Taiba, she actually, yeah, you managed quite a few introductory workshops. Perhaps you can also share your experiences with us about key challenges.
Sure. So the introductory workshops are usually aimed to tell our participants what is being expected from them and what they should expect from us as a facilitator during their journey of photo voice. People come up with a lot of questions, and most questions are around the type of the pictures that they should take. And there is a guidance. Özlem will, I'm sure you will share with us for the do's and don'ts of taking pictures and the type of the pictures that they should bring and the type of the pictures that they should avoid. During introductory meetings, we introduce them to our distress protocol. We introduce them to our check-in sessions, like the standard calls that they will receive from our trained researchers during the process, during the time when they will be taking the picture. So this is the main purpose of introductory meetings. And mostly people come up with questions related to the type of the pictures that they should take and bring. Yeah.
Mhm.
We have other people, Özlem, in
Yes.
the group, like Midhat. I'm not sure whether Midhat has managed to attend. We have Abdul. Abdul has
Yes.
recently done an introductory meeting. Abdul, do you want to add anything to the introductory meeting, your experience of doing that? While I am checking, Özlem, whether Abdul is here or not, Samia has raised her
Yes.
her hand.
Yes. Hi, Auslam. I want to ask you, we are only taking photographs in PhotoVoice, or also we are taking the um, artwork or drawings that patients made to express their feelings, or words they convert in the form of the drawing or art. We can also take that.
Oh, yes, that's a very relevant question. Thank you, Samia. Actually, we will cover that. Yes, we can take drawings of participants because sometimes, well, the idea of taking a picture of their experiences is to help them communicate things which are difficult to communicate through words, of course. If participants are struggling with taking pictures, sometimes using other art-based methods like drawing a picture, it could be an alternative. So participants can still take part in the process of reflecting on their experiences. So this is also, yes, possible in PhotoVoice. And that's also another unique, let's say, aspect of PhotoVoice as a technique, that it's flexible. It has room for flexibility. Yes.
Okay, thank you, Auslam.
You are most welcome. And going back to, yes, Asfa, yes.
Hello, Aslam. I want to know about the safe space. If the patient don't have a safe space before, so we have to create his or her safe space first.
Yes. Oh, yes, that's one of the tasks of the introductory workshops, creating that safe space. Well, about that, I wonder if anyone wants to share their experiences from introductory workshops. I think Taiba mentioned about Abdul. I don't see other people on the screen.
Abdul was here a while ago. I think he got disconnected. Also.
Yes. Anyone else? I think it will be relevant to give a concrete example instead of talking about what safe space means. Then it will be very abstract. Rabia?
Hi, Oslam. Yes, one thing, Oslam, what I experienced during the introductory workshops, I have not done this with the patients, but this is my own experience. Like sometimes it's difficult. You have selected a picture, but you are not truly able to reflect what you are feeling and how you are relating to those pictures. So I think sometimes this is important. Like you don't have the true words to reflect on those scenarios and selected pictures. This is my experience. Like your feelings are more stronger than your words.
Yes. Yes, thank you. Thank you, Rabia, for sharing this. That's very important. We will get back to it. And Adnan?
Yes, thank you, Aslam. PhotoVoice is quite new to me, but I just want to learn, like being a burn survivor. If I am facing social pressure, mental trauma, agony, like this, like how I will express that in the photo.
Okay. Yes. Yes. So this actually brings us, this brings us to what kind of pictures participants take during the photo voice process. And actually this brings us to the discussion about do's and don'ts. So in terms of the type of pictures participants take about their experiences. So they could be pictures, symbolic pictures. So for instance, in terms of burn survivors, so the pictures they take and they share with us, they're not pictures of the scars, for instance, because that would upset other people, or it might trigger, let's say, distress among other people when we are having a group discussion to talk about the pictures. But pictures of day-to-day experiences, and I remember one of the pictures was just cup of tea. So cup of tea was for that participant. I don't know if the facilitator who was working with that participant is here, but for that participant who brought the picture of cup of tea was a tradition, something that participant used to do before being burned. So it was a tradition, that a routine that participant used to do, and it used to be a very relaxing routine. But now it's like it has bitter memories for the participant. Like things are different now. Like things I used to enjoy don't give me much enjoyment anymore. So this is an example of a symbolic picture that participant takes during the photo voice process. Yes, Atika, you wanted to give input in this discussion?
Yeah, like if you are asking passion for the picture, mostly burn survivor, but sometimes for us and for all the people, that picture in that thing is very ordinary thing, and we couldn't take that thing serious. But for a burn survivor, that means a lot. Like they can't do that. Even a glass of water that they can't take, or even they can't go upstairs or downstairs. These things really matters. Even you can't imagine the picture that they brought, it has lots of feeling and experiences related to social stigma, personal experiences, pain, family. There is lots and mix up even a huge emotion related to that picture.
Mhm. Yes, yes, thank you, Atika. So it symbolizes the experiences, let's say the objects they choose in that picture, the surrounding of the picture. So everything might have a meaning for the participants. So during the reflection process, which we'll talk about, so we reflect on those. So we ask participants to reflect on those aspects of the picture. And like Rabia said, this is also not an easy process because sometimes participants, or most of the time, struggle to find words. Rabail?
Yes, regarding the safe space, I would like to answer.
Yes.
Like regarding the safe space, we always ask the participants in which setting they are more comfortable. Like we ask them in which setting you are more comfortable to share about your experience, whether it is while you are at home or is it through the online medium, or whether you can tell us about your experience while being at the hospital setting. So we always give preference to the settings they choose for themselves. So it is very important, and then to build the trust and to show them about the confidentiality, it is so much important to create a safe space so that they are able to share the feelings which they are actually experiencing. So this is how we can create safe space for them.
Yes, thank you, Rabail. Yes. And about the safe space, so safe space is like we are doing here. So hopefully you all feel free to express your opinion because this is an open, so we are having an open discussion. So you ask your questions and everything is okay, the questions you ask. And we try to clarify, understand each other. So we take turns, you raise your hand. So these are all part of safe space. And these are some of the things we do during the introductory workshops with the participants. So we are here for them. And they are the ones taking leads in terms of taking pictures, what they want to share with their pictures, how much they want to share. And confidentiality, I think Afshan also emphasized this. Confidentiality, and Rabbi also gave an example of this. It's something we also emphasize during the introductory meetings. And their role as decision makers of their own experiences. Because like Rabia also mentioned, one of the key struggles, and I think Atika also mentioned, so participants who are there, usually they experience stigma because of their experiences. Being a burn survivor, for instance, and living with burn injuries in daily life. So they experience stigma. They are perhaps used to receiving questions about the incident, or it could also have impact on their social life, their employment. So they will bring all those experiences to that introductory meeting. And it's very important for us to be neutral, to be sensitive, not judgmental, and to give the message that this is a safe space, it's confidential, and they make the decisions about what they want to picture, how they want to communicate their experiences. I see that Samia raised her hand and Adnan. So let's go with Samia first.
Yeah, I would like to add experience discuss with me about few patients. Patient like Simra has added in messages. So one of the patient whenever talked about cup of tea, it reminded her about the painful experience of one. So many patients, whenever we try to do assessments or during intervention, they reported that they feel very uneasy and go to early memory. And at that time, when the burn experience happened, whenever anyone asks them about what happened, and whenever try to interact with other people or go outside the home and try to meet someone, when they ask questioning about the incident, that thing remind them of that incident, and that is so distressful that they started avoiding interacting people and remain at home and not meeting people. So it may be difficult whether we are using a photograph or any artwork, or even we are saying please express your feelings in colors form. It's difficult for them to express that thing that they want to dig in their mind, in somewhere they want to forget that. They don't want to discuss and talk about in future and more. That thing reminds them of the distress and pain they feel and experience.
Yes, thank you, Samia. Yes, yes. Adnan?
Yes, I just give an example. Like being a breast cancer survivor or a patient, I face pressure from my family and especially my spouse. So you want me to bring a symbolic picture, like it should be having a husband yelling on her wife, like that.
Oh, yes. So,
If
in
it
terms
is
of
yes, sorry. If it is yes, then how we are going to communicate with our participant, the breast cancer survivor or the patients in the community, which are, they are not very much educated.
Okay, yeah, thank you, Adnan. So two questions, I think, two aspects of the question. About the pictures they take. Yeah, we do, like Taiba mentioned, so we do have do's and don'ts, and we do discuss them during the introductory workshop. But our role as a facilitator, except for the distressing pictures, which might be upsetting for other participants, so pictures might be too, those pictures might be too graphic, or like the one I mentioned, the pictures of skies, etc. So except for those pictures, participants can choose. They might choose to take symbolic pictures. They might choose to take different kinds of pictures, but we do not give them instructions about how they need to picture their experiences. But these things, for instance, the pressure, the social pressure you mentioned, Adnan, or the examples Samia gave. So these things we discussed during the reflection meetings with the participants, the meanings of the things they have chosen to picture. I don't know if that answered the first question.
Just to have a clarity, like the participant is not very much aware. They are not and they are not educated. They are from the community. So how we are to engage them for this photo voice exercise?
Yes. I wonder if a facilitator from Burns Project would give an example, would share their experience with engaging with participants, because we do engage participants from community, and it's also a new concept for them. So I wonder if a facilitator wants to share their experience about engaging participants about photo voice. Anyone? Atika, do you want to share your experience? I think you did introductory workshops with participants.
Yeah, for engagement, the passion, like there are some, some patient are in a denial process and they want to go for that. Like we have a participant and she shared that just 2 pictures, and for the further she refused that. that I don't want to recall the whole process. And there are some cooperative participants, but the circumstances and environmental factor don't allow them. Like due to cell phones, they don't have that cell phones to capture that one, even if they ask for the help. So these are that kind of barriers. Even some participants are ready to share the pictures, but again, if you ask them the pictures, although they share many, but again, some are confused. But some participants are gonna exactly share that one pictures, or even that they will breach the safety somehow. Like if the incident happened due to fight or framework, so they are gonna share that pictures, which is a bit challenging for them also and for us also. Even some participants, we can say, due to language barrier, you can't even engage them, or even due to some gender challenges, it also matters in a whole process.
Mm-hmm. Yes. Yeah, we will cover the challenges, and we have a lot of things to cover actually. So one last question, then or input, and then we will move on. Abdul is here as well. Abdul, you have done introductory workshops. I wonder if you wanted to reflect on your experience. Yeah.
Yes, sure. Thank you, Dr. Aslam. It was a great experience. I really enjoyed it. And I did not think of it earlier that I could face a question. One of my participants asked me that I didn't really face any difficulties and I'm better now. So what could be, what should I keep in my mind while I'm taking the photos? So Dr. Tayyiba guided me there that we can also tell them that anything that have motivated them to get better, anything that they want the other survivors to know, so that it can help them as well.
Yeah.
So when I shared that perspective with him, it really motivated him, and he shared that he will participate in that. So that was a really good question that intrigued me also. Thank you.
Yes, thank you, Abdul. Yes, that also brings us back to the photo voice technique as a participatory action research technique, that it does not only ask people to randomly share their experiences about their pictures, like, oh, what do you want to share with this? What do you want to share with this? But it also motivates them to empower their community. So through your pictures, how can we, let's say, improve the lives of others? How can we bring a change? How can we, let's say, inform others about the struggles that you face? How can we give voice to others, other burn survivors? Yes. One last question or input. Adnan, I see that your hand is up. Yes.
Actually, the issue is that I work with the women in the community. So it's very hard to know that they are facing, they are breast cancer patients, or they have lump in their breast, or like they are the survivor, they are undergoing the treatment like this. It's very difficult for them to disclose. So identification is very hard for me. So how it is going to work that when some participant is not sharing even that they are going through this kind of cancer, like the very serious breast cancer. So how they will agree to share their thoughts, and like so much and being in the high pressures, so and facing so many cultures, socio-cultural, economic and educational issues, like illiterate, like with low income, with so much pressure. So how they are going to be to participate in this process? As you said, that it's a participatory process.
Well, the thing is, so they don't have to communicate through words about all these pressures, struggles, etc. But they take part in taking pictures of their experiences. So maybe not everyone takes part in picturing their experiences, but people do. And that the Burns project that we have, it's an example. Because like we said, some things are very difficult to talk through words, or people don't have words about them. But with pictures, they can choose how to symbolize them, how to communicate about them. Yeah, this is what Photo Voice is about. Yes, let's save the questions for later because we have a lot to cover. So we will move on. But it's good that we cannot resolve everything for now. So let's leave the questions for later. Yes. So in terms of introductory workshops, so we did talk about the key things, the key challenges, and like the questions that you asked. So many participants who are interested in Photo Voice, they would have those questions. What kind of pictures? Yeah, what if my picture is judged? Or like what is Photo Voice process? What is it about? The things I share, would they remain confidential? So all those questions, all these things need to be covered during the introductory workshop. Or some participants, they wouldn't be sure about the pictures, etc., like type of pictures. So during the introductory workshops, it's also important to go through some basic photography with them, and do's and don'ts when it comes to typo pictures. Or like the example Abdul shared, it's also important to motivate them about the type of pictures that they could take, the type of things that they could reflect on. Yes. And it's very important to go through the ethical process with them and have their informed consent. This is just an example from a community setting where people have disposable cameras and take pictures. But I think in our Burns project, so things are different, that people take pictures with their mobile phones. So after the introductory workshops, so participants are introduced to Photo Voice process, and we have their informed consent, so they take part. They agree to take part in the Photo Voice process. So they are given instructions to take pictures of their day-to-day experiences, for instance. That's what we do in the Burns project. So they take pictures of their daily life living with burn injuries. And so they take pictures for some time. They can take as many pictures as they want, but we do follow them up. And then the next step is to organize photo reflection workshops. So in these photo reflection workshops, so participants who take part in the Photo Voice process, so they bring the pictures they take. They select, let's say, 5 pictures, and they bring their pictures to the photo reflection workshop and discuss. That's where they discuss their pictures with the facilitators. So if this is a group setting, so there are other participants who are also taking pictures. So there's a group discussion. But if it's a one-to-one meeting, it can be, because sometimes participants they might not want to be in a group setting. So the facilitator has one-to-one meeting to reflect on the pictures. And so the purpose of this photo reflection workshop is to, yes, reflect on participants' picture, reflect on the process, and also ask specific facilitation questions to develop captions and themes about participants' experiences. And what are these facilitation questions? Let's let's go through these facilitation questions. So these are open-ended questions that facilitators ask about participants' experiences to guide the process of sharing what they want to communicate through their pictures. So it starts with very open-ended questions like, what do we see here? Okay, this is one of the, so what do you see here? What do we see here if it's a group setting? So what is happening in your picture? How does it relate to our lives? Or how does it relate to, for instance, when it comes to burn survivors, the project with the burn survivors? So how does it relate to your life as a burn survivor? So why does the problem that you are reflecting in, you are representing in your picture exist? And what can we do about it? Yes. Yeah. This is we haven't done any so far. We have done introductory workshops in the burn survivor project, but we are about to start conducting photo reflection workshops. So when it comes to things we discuss about the pictures, I will give you an example, for instance. I will skip these for the time being. We will get back to them. I need to share my screen again. And I cannot find it. Okay. Well, maybe we can have questions until I resolve the technical challenges. Yes, I think I found it.
I'm Asif here.
Yes, please.
It's my first workshop about the PhotoWise. Just I want to know, it's a screening tool or supportive tool or assessment tool?
Oh, PhotoVoice is it's a research method that we use. It's grounded in participatory action research. Well, it is not a screening or assessment tool, but it's a tool that we use, for instance, like interviews. It's a tool instead of interviews, so we have pictures. We ask people picture their experiences, and then we do organize photo reflection workshops to reflect on their pictures, and we talk about things they wanted to communicate through their pictures, yeah, how can we use their pictures to improve the lives of others, for instance? So it bridges the gap between research and real life in that sense. Yes. Thank you for the question. Noshin?
Yes, hello, Dr. Uslam. This is Nausheen, and I'm using the PhotoVoice for my research, which is with childhood trauma participants. So I want to ask you the questions because we are right now about the guidelines and the showed method to use. So is there appropriate guidelines which we can use to customize our own questions?
Yes. We also have a PhotoVoice toolkit that we developed for the project that we do with burn survivors. So we have collected the guidelines there.
Okay. So based on that guidelines, we can have our own questions, customized questions.
Yes, exactly. Yes, then you can adapt it to your own project. Yes. So we do have topic guides as part of the Photo Voice toolkit that we worked on.
Okay, thank you. And there's one more question. Can I ask?
Yes, of course.
Yeah. Okay, so while the participants are sharing or reflecting on their photos, how can we ensure the emotional when they get emotional while sharing or reflecting on their pictures? So what's the best practice to deal with that? Because in sessions, it's a different way, how you cope up with the emotional state of the client. But how we do in this session?
Yes, it's one of the challenges. I think Taiba earlier mentioned about the distress protocol. So it's very important to have also a distress protocol in place when it comes to facilitating the photo reflection workshops, because it's inevitable that people would get emotional while they are talking about their pictures. I think Samia also earlier shared an experience. For instance, it was just a picture of a cup of tea, but it had so many other meanings about the things the participant struggles, things the participant used to enjoy but not able to do anymore. So this distress protocol is very important. And I see that Taiba, you raised your hand. Maybe you wanted to talk about this distress protocol.
Yes, we are happy to share our standard distress protocol with Nosheen. And Oslam, I'm thinking while Aisha is also doing photo voice with pediatric population, pediatric burn injuries. So it would be a good idea to connect Nosheen with Aisha. So Nosheen, I will share Aisha's email address, mine and Oslam's as well. So you can always write to Aisha. I think meeting Aisha would help.
Okay, thank you so much. Thank you so much.
Yes, thank you, Noshin, for the questions. I think there was someone else.
I think Amina Ali.
Amina, yes.
Assalamu alaikum, everyone. I just wanted to ask that how many sessions of this workshop of photo voice is done? Because if we have a group, then talking about the pictures will definitely be taking some time. So how many sessions do you take this? Because this is a group interview, as I understand. It's not a one-on-one.
Yes, photo reflection workshop, it can be a group meeting, or it can be one-to-one. And how many? So there are no, because it's a flexible technique. So we cannot say that 5 photo reflection workshops would be enough. So it really depends on the